Assalamualaikum and good evening everyone. My name is Rebecca Ashkimiti Muhammad Zaki and my metric number is 211619. This is my friend Siti Mesara binti Bakria and today we would like to present about the virus. And I know that you probably heard this living a million times before, right? The virus. It is the most dangerous living of life that can give harm on us. So what is exactly a virus? A virus is a tiny infectious agent with a basic structure that can only replicate in live cells of animals, plants, and microorganisms. There are several types of viruses that have been proven by scientists, but thousands more that have not yet to be found. And in this presentation, we would like to present about two types of virus, which are HIV and monkeypox virus. So I'll start with an explanation with HIV virus, and for the monkeypox virus, I will pass to my friend to explain about it. Okay, so now let's start our presentation with a really simple question. Do you guys know what is HIV? Of course, it's a virus, or we call it as human immunodeficiency virus. This virus is composed of 2 strands of RNA, 15 types of viral proteins, and a few proteins from the last host cell it infected, all surrounded by a lipid bilayer membrane. Together, this molecule allow the virus to infect cells of the immune system and force them to build new copies of the virus. Since 1986, research on the structural biology of HIV have revealed the details about the HIV. And this structure are all publicly available in the Protein Data Bank or PDB. I know you guys must be wondering where HIV comes from. So here, I would like to tell you the origin of HIV, and it is an interesting fact that HIV infection in humans came from a type of chimpanzee in Central Africa. This chimpanzee version of the virus called simian immunodeficiency virus or SIV. This virus was probably passed to humans when humans hunted this chimpanzee for meat and came in contact with their infected blood. Studies show that HIV may have jumped from chimpanzee to human as far as the late 180s. Over decades, HIV slowly spread across Africa and later into other parts of the world. We know that the virus has existed in the United States since at least the mid to late 1970s. Next, we will talking about the symptoms of HIV. Some people infected by the HIV develop a flu-like illness within 2 to 4 weeks after the virus enters the body. This illness, known as primary acute HIV infection, may last for a few weeks, and the possible signs and symptoms include fever, diarrhea, sore throat, weight loss, and of course the headache. The other symptoms we can see such as rash, swollen, night sweat, and cough. These symptoms can be so mild that you might not even notice them. However, the amount of virus in your bloodstream or viral load is quite high at this time. As a result, the infection spread more easily during primary infection than during next stage. Okay, now I would like to tell you about the transmission of HIV. Most people who get HIV get it through sex or sharing needle, syringes, or other drug injection equipment. In addition, HIV can be transmitted from a mother to her baby during pregnancy, birth, or breastfeeding. However, it is less common because of advance in HIV prevention and the treatment. This is called perinatal transmission or mother-to-child transmission. Mother-to-child transmission is the most common way that children get HIV. Recommendation to test all pregnant women for HIV and start HIV treatment immediately have lowered the number of babies who are born with HIV. So we already know about what is HIV and where it comes from, about the symptoms, and of course about the transmission of HIV. So now I would like to share about the treatment for HIV. So is there any cure for HIV? Currently, there is no cure for HIV. Once you have the infection, your body can get rid of it, but you can control it with HIV treatment. The treatment for HIV is called antiretroviral therapy or ART. ART involves a combination of HIV medicines called an HIV treatment regimen every day. ART is recommended to people who has HIV, and people with HIV should start taking HIV medicine as soon as possible. I think that's all about HIV, and I hope you are clear about what I'm saying. And for the next part, I will pass to my partner to explain about the monkeypox virus, and let's hear from her.
Thank you, Ashikin. Now, I will continue our presentation about the monkeypox virus. So, what do you know about the monkeypox? Let me explain to you. The monkeypox virus causes the illness that called monkeypox. It is a zoonotic virus, which means it can be transferred from animals to people, and it also has the potential to spread from person to another person. As you can see here, this is the image of the monkeypox that has been discovered under a microscope. Do you know that monkeypox virus first case reported at Democratic Republic of the Congo, DRC, that located in the Central Africa? Monkeypox was first discovered in 1958 when the outbreak of a pox-like disease occurred in monkey cat forests, but the first human cases was recorded in the 1970s. There are many symptoms of monkeypox. There are some obvious symptoms that we can detect early. First is the fever. The invasion period is lasts between the first day we infected into the 5 days after. Second is the skin rash. The skin eruption usually begin 1 to 3 days of appearance of fever. The rash tend to be more concentrated on the face. It affects the face, palms of hand, and sole of the feet. Other than that, the patient also had back pain, muscle aches, and headache. The symptom can lasting from 2 to 4 weeks. Severe cases occur more commonly among children and are related to the extent of the virus exposure, patient health status, and the nature of the complications. How this disease spread? So it can be spread by the animals to human, that we call it as zoonotic. The transmission can occur from direct with the bodily fluids or cutaneous or mucosal lesion of infected animals. Many animals in Africa have been confirmed to have been infected with the monkeypox virus. A possible risk factor is eating undercooked meat and other animal products from infected animal itself. Other than that, people who live in or near wooded region may be exposed to infected animals in indirect or low-level exposure. Then we have the human-to-human transmission. Human-to-human transmission can result from close contact with respiratory secretion, stimulation of an infected person, or recently contaminated object. Transmission via droplet respiratory particles usually require a prolonged face-to-face contact like sneezing. Other than that, the transmission can also occur via the placenta from mother to the fetus, which can lead the congenital of monkeypox, or during close contact during and after birth. Lastly, I will explain about the treatment for monkeypox. Unfortunately, currently there is no specific treatment approved for monkeypox virus infection, but the good news is we have the development of vaccinia immunoglobulin that we call VIG. This vaccination can boost our immunity system to fight the virus. For patients, they can take tecovirimat, or we call XTP or XX. It's an antiviral medication that used to treat the monkeypox. This medicine used to reduce the skin rash that affected them. For conclusion, HIV and monkeypox are the viruses that can harm humans. It is important to us to know about the viruses, like the symptom, how it can be spread, and the treatment that we can get when we are infected. Normally, all the viruses give bad impact to our health. It is important to take action before we get sick. That's all for our presentation today. Thank you for listening.